Ladies and gentlemen, welcome once again to the Think Clinical podcast. This is another very exciting episode. My name is Hamza, and as you know, it's always a good experience to share what I know with you and look at how healthcare can evolve over the period of time. And just like every week, today is another very important week that we need to look at some ways we can make our healthcare practices, healthcare businesses more efficient. If you follow this channel for a while, we are all about adding knowledge to what you already have and pointing you in the direction of tools that you can use to improve the quality of healthcare that you offer. Tools that will help you improve efficiency as well as improve profitability. So welcome once again. It feels so good to be here, and today we'll be talking about a very important topic around the subject of AI. And this is a topic that, regardless of how we want to tackle healthcare businesses, it's gradually becoming a part of the healthcare landscape. It's becoming a part of the healthcare business landscape. And because of the depth to which I want to discuss some of these issues, this will be a two-part episode. So the first one will just be an overview of how and what the role of AI has been in the healthcare space. And the second part of this video is going to be about how you can implement AI in your business if you want to, and if you appreciate the value it brings to your business. So this is going to be a very exciting episode. So welcome once again, and if you haven't done so already, please remember to subscribe, like, and share. It's always good to have you join us, and all the contributions and suggestions that you bring to us, we really do appreciate that. So welcome once again. So when we talk about the issue of AI, a lot of people look at this as something that is very futuristic. So people tend to defer the opportunities AI bring in, the role it plays in the healthcare space. People tend to defer this into the future, but increasingly this is happening now. And in this episode, we're talking about how healthcare entrepreneurs can leverage AI, especially in your hospital business or your healthcare business. And we'll also be talking about some AI tools that you can build and monetize for your own business. So these are the two things that I'm going to be looking at in this two-part episode of what we'll be talking about here. So when we look at it, there's no doubt that AI, just not even in healthcare, in every sector and every industry that I've looked at, AI is really, really causing a lot of revolution. And if we look at the concept in healthcare, is playing a role all the way from diagnostics to personalized care. So AI has the potential, if you would, to make a healthcare business more efficient, more accurate, and even more accessible. So this is what the three main areas people have used AI to be able to do a lot of these things. Efficient in your workflow, efficient in how you speak to patients, efficient, so we have AI systems that can schedule patients for you. We have AI systems that can speak to patients for you. We have AI systems that can schedule appointments for you. We have AI systems that can interact with patients through a chat system or a chatbot. We have different AI tools that have been able to work on the item of efficiency. So you don't need a physical body sitting in there and chatting with patients and verifying insurances and putting people on a schedule. People have gotten to that stage where they have AI systems doing those for them. Let's talk about accuracy. The biggest contribution of AI to accuracy and in diagnostics has been in imaging. So we have AI tools now that have the capacity to read radiographs and be able to suggest possible things and identify possible lesions that you may have missed when you were, as a human being, trying to evaluate them. And we do have a huge margin of error as even doctors and the most experienced ones to miss certain lesions. AI, and there are AI tools in the market now that have been able to contribute significantly to the space of diagnostics and helping doctors to make more accurate diagnoses and treat patients appropriately. And in terms of accessibility, as I said, AI tools have been able to make and have been able to interact and give advice and engage patients 24/7 in your healthcare business. So the contribution of this cannot be overlooked. And if you are in business today and you haven't considered looking at AI tools that you can incorporate in your business to make it more efficient, to be able to present more accurate diagnosis and more accurate information to patients, and to make your business more accessible, you are probably lagging behind at this point, because this is happening now. This is not a conversation for the future or something you should look forward to. Now, let's look at the areas where people leverage AI in healthcare. First of all, as I said, diagnostics. So we've had so many AI tools in the market now that have been able to help doctors to look at their radiographs, and they usually will catch anomalies that as human beings we don't have the technical eye to be able to catch. So this is usually used especially in pathology and radiology, where the AI tools have been very, very, very instrumental in building in helping with diagnostics. The second one is in predictive analysis. And because AI has the capacity to analyze a vast amount of patient information, it's able to use this information from previous patients, previous admissions, previous surgeries, previous interventions that are similar to what that specific patient is going to experience. It's able to use that information to predict the outcomes of specific patients or specific group of patients. Not only that, items like readmission rates, AI has been able to collect hospital data dating back 5-10 years and has been able to use that information to accurately predict the readmission rates that should be expected within the hospital. So this helps hospitals mostly to be very proactive in how they plan, and especially when you have to allocate resources, you have information, you have the data to be able to allocate resources properly to see which areas of your business you need to properly support. The third thing we are talking about is personalized medicine, and this is where most healthcare businesses are moving towards. And AI information, AI tools now have the ability to analyze a lot of genetic information and other health personal data, and using that information to be able to carve out very personalized treatment plans, very personalized medical interventions for specific people. So it's not longer one size fits all. It's about looking at your personal information, looking at your genetic information, and based on that, personalize the care that you get from any healthcare hospital. So that's the third thing in personalized medicine. The fourth one is in the area of operational efficiency, and this is one of the big things for me as an operations person, because whenever you look at the pain points in operations, there are certain things that, regardless of how many people you put in there, regardless of how many employees, to be able to double check all the things that happen, there's still a huge margin of error. There's still room for frustration, because humans get tired, humans get exhausted, humans get memory lapses. Humans have challenges that AI tools, I will say, fortunately do not have. So one of the things that you experience is that AI tools have been used now by people to be able to optimize their scheduling, so you don't have to think through the process. The AI tool is able to identify where to put specific appointments, specific procedures, in order to make your schedule very, very productive, as well as make sure that you are not running around your clinic as like a crazy person, if I may say. So that's one side of it for operational efficiency. The other side of it is managing inventory. So we have AI tools right now that can manage your inventory for you, and as well as streamlining your administrative tasks and enhancing patient care. So when you look at all these things, A lot of the time, people have been able to build AI tools that speak to each other, and that actually streamline this whole process from the time the patient reaches out to the hospital for an appointment, in which case the AI tool is what will interact with the patient with text messaging. The AI tool is the same tool that will interact with the patient if it's a call. The AI tool is the same tool that would verify information. This might not be from the same company, but we have tools that more or less speak to each other now, where as the patient calls in to get an appointment, their AI tools that prep the patient and make sure that they have all the information, everything needed. New patient forms are sent out to patients to complete and sent in. Within the visit itself, or the day of the visit, they have AI tools that help patients to check in automatically at the check-in point. So the number of times a person has interacted with any person is reducing gradually, but the accuracy with which information of the patient is being presented to the physician or the clinical team is increasingly getting higher. And this goes all the way to after the patient visits with claim submission, following up on unpaid claims, and all that. So it's the whole cycle from the time the patient comes into the patient goes out. AI tools can be used, and even when they go to clinician, as I said, we have predictive tools. We have tools like the diagnostic tools that help with radiology and all that. The last item I want to talk about is in the area of virtual assistants. And virtual assistants mostly are the biggest tools that healthcare companies use now. And they come out in a form of AI-powered chatbots, as well as virtual assistants that can handle like very routine tasks. This is my insurance. What is my breakdown? What's my copay going to look like? What's my co-insurance looking like? What are my deductibles? It's able to answer all these routines once you feed the information into the AI system. And so you don't need a human component in there to be double checking and trying to come back with information and making sure they give accurate information, which a lot of the time still has lapses. So if you look at it in the context of a virtual assistant or chatbots, you have a lot of hospitals whose websites now are powered by AI. And from appointment scheduling to who you interact with whatever are powered by AI. Somebody might argue that human component is gradually being lost from the healthcare system. Is that the situation? And my answer is definitely not. What is happening here is that we are getting to a point where these AI tools are getting more and more intelligent, and they are able to have conversations with people most of the time without people realizing that they are speaking to AI systems. Secondly, if I am going to a hospital and I want to bank on accuracy, I want to bank on making sure that the right information about my insurance is captured, making sure that the right information on my medical history is ready for the doctor to view when they move into my chart, making sure that the doctor looking at my radiographs or any other tools is able to get the right information from those tools. I will definitely lean towards this. So yes, there is a concern, and technology as a whole has replaced gradually a lot of human components to different businesses, just because they give the businesses an opportunity to scale, to grow, without adding on more overhead. So some of these conversations, and again, as we say, there is no way an AI system would completely wipe out the human component in healthcare, but it is becoming a very important component of it in supporting healthcare providers to be able to provide the right kind of care and accurate kind of care. This is obviously a topic we can talk through on another day, but for today, we will end this episode here, and we'll continue the next episode on how you can implement AI systems in your healthcare businesses when you want to. But in the meantime, if you haven't done so already, please remember to subscribe, like, and share. And I will see you again in the next episode of this, our AI series. Thank you, and have a great week.